Well, first, I did not know Jim and Vanita Oschlager, and I'll tell you, the generosity and the kindness of those people was just amazing. And what they asked us to do was unprecedented. And they more or less gave us full reign to create their vision, which was an MS center that was like no other, that would not only address medical needs, but psychological, education, financial, family needs. It was something that had never been done. There is no model for Oak Clinic. We are unique.
I think the biggest challenge was are we going to see patients? Are they going to come into the clinic? I think it was my biggest fear is what was going to happen after we opened.
I remember Dr. Carabine sitting down with me saying, we're going to have a nice little practice. It's going to be quiet. We'll serve the uninsured. And within 2 or 3 weeks, the word went through like the MS grapevine. And the phone was ringing off the hook because patients had heard that there were healthcare providers that not only listened to them, that understood the disease, that cared about them. And before we knew it, we had underinsured, overinsured, uninsured. Everybody was calling here. And we were just overwhelmed, and it was not what we expected. So we had to change the model of our care and changed our business setup.
It's totally different. And I tell this, I teach the medical school, I teach medical students. Sometimes I have medical students or even residents who shadow me. And one of the first things I always tell medical students or residents when they come in and work with me is that don't expect this to be like a normal, quote unquote, normal place.
We had a great opportunity to open a really nice clinic that served the MS community, which we thought was being underserved.
The clinic was a gift from Jim and Vanita Oschlager, and it has always been established that the clinic would serve people regardless of their ability to pay. Not just the patient, but also their families. And so I think what has happened is that we have stayed true to that. We continue to make sure that above all, no matter what, our patients are taken care of.
Anyone could come to the clinic and get great care and not have to worry about whether it was going to cost them money or have a big bill or something like that. So that's always been a big part of the clinic. So that was exciting.
Thanks to all the support from Jim and Vanita, it's just different here. We can spend more time with patients. We're not under the pressure to see 50 patients a day to stay in business.
It exceeded my dreams. It definitely exceeded my dreams. I mean, if you really think about the beginning, and Dr. Carabine and I talk about the beginning, we had all of our files in a cardboard box. We were in a timeshare. We had one X-ray box. We did not foresee any of this, and I am just so pleased and so happy.
Although we encompassed a lot of services at the beginning, I feel like we've really expanded our services. So the infusion suite, for one, we started the infusion suite. We take care of all of the patients that are on infusions. So we've grown that from doing no infusions to doing about 375 to 400 infusions per month. So it's pretty phenomenal. We also added our own pharmacy. The pharmacy handles our injectables and orals and things like that, but we have a concierge pharmacy with an incredible staff. We have exercise classes. We have yoga classes. We have stress and mood management classes. We do the caregiver seminar. We have classes for children.
The employees here are different too. It's just everybody realizes that we're all dealing with a disease process that impacts people's lives to a great degree, and I think that everybody has a primary in their mind to trying to help patients as far as answering questions, making them comfortable, trying to help them as much as they can. It's just a different environment than any place else I've ever worked.
We all put our hearts and souls into it and never even considered that we would fail at any aspect. When you believe in something so deeply, you cannot fail. We had passion, we still have passion. The staff we have today has the passion to continue that mission.
The thing that I can say is that I think that our staff, and I'm super proud of them, we're really good at what we do. And we're really good at taking care of our patients.
What makes it a little different is that we spend time with patients and we're here to listen. That's probably the biggest thing we do is we're able to listen to patients and hear what they have to say, what their concerns are, what their wants are.
I get to say to patients, I understand what you're saying. I get to validate the feelings they're having. I get to give them support and hope and a future picture of what living with this will mean to them.
I think I really like Jim Olschlager's quote that, none of us can wait till MS stands for mystery solved rather than the disease that we deal with day to day. So
I think we provide just excellent care to the patients. We love the patients. I think some love us back. It's been a good thing. I think we've changed lives. I think people that kind of came in here that had no hope in the past now do. They see that there's some good times and there's things that we can do that are positive together. Some patients have told me they feel the Oak Clinic's their second home. So it really has surpassed anything I thought it would ever be.
It is unparalleled. The gift to the MS community cannot be matched, cannot be duplicated. I am just totally overwhelmed. Everybody here it's a privilege to work here. It's a privilege to come in every day. This area, this place is a blessing to the entire MS community and a credit to Jim and Benita.